Hi, I'm Dr. Anna Marie. Thanks for joining us. Today we're talking about flat feet and a condition called overpronation. Both can be rather complicated for those suffering from the foot problems. Unfortunately, there are plenty of misconceptions out there. Let's take a close look at overpronation and flat feet to find out exactly what causes these conditions, why they're bad, and what can be done to fix them. We're very fortunate to have two of the leading foot and ankle specialists with us today, Dr. Michael E. Graham and Dr. T.J. Ahn. Doctors, thank you so much for joining us today. Feet, big problems in our country. Tell us about overpronation and flat feet. What causes them?
Yeah, well, thank you so much for inviting us here today. And yeah, overpronation seems to be such a complicated problem, and as far as flat feet too. And one of the big differences is that with flat feet, usually you have that fallen arch, but what causes that arch to fall stems back from the hind foot and the alignment of the ankle bone. So when that ankle bone becomes unstable, that's what causes the overpronation. So you can actually have overpronation without having a flat foot. And I think that's why there's so much misconceptions that are out there.
A lot of confusion. A lot of people probably think they're the same thing, right?
Right, exactly. Because pronation is a good thing. We need to have some pronation in our feet because that's when we're walking, it allows the foot to adapt to uneven weight-bearing surfaces. So pronation is good, but too much of anything is bad.
Okay, and if there's too much of something bad going on, does it cause sort of like a dislocation? Is that what's happening?
Yes, basically ankle bone dislocates over heel bone. And I still have my practice in Chicago. A lot of patients come to see me for other symptoms, and they don't realize it is caused by overpronation or that hind foot dislocation over heel bone.
There's sort of like an excessive motion going on in the ankle joint. Is that what's happening?
Exactly. And so what we can do is we see here on this film, which is a weight-bearing fluoroscopy, the normal amount of ankle bone motion. And there is a clear space called the sinus tarsi in between the ankle and heel bones. So that space should always be open. And now we can see on this other film, again, weight-bearing, that how the ankle bone, it's sliding too much on the heel bone, and that space is closing over abnormally.
So what can be done to fix this, if anything?
Well, again, this is the big misconception. So many parents bring their kids to the pediatrician and say, look, I'm concerned about my child's feet. They're flat, they're just not straight. And the pediatricians usually will say, and this is, in the literature and out there, and this is one of those myths that don't worry, they'll just outgrow it. But unfortunately, there's no evidence basis for that. And then as the years go on, it gets progressively worse.
And it gets worse, and it can actually affect the rest of their health, correct?
Yes, sometimes the whole family comes, grandparents, parents, and children, and then they have similar that genetic trait, and then almost like grandparents showing a lot of symptoms, and then I can almost foresee these children may develop into their parents and their grandparents' symptoms.
What does this mean for the rest of the body, though? Because obviously the feet are the foundation of your health, right? That's why you guys, in the sense of the atlas, being a foundation, a strong foundation.
Right.
How, if your feet are misaligned, sort of like a tire being flat, how does it affect the rest of your body?
Well, exactly, because the whole body rests on the ankle and heel bones. When the ankle bone turns inward excessively, well, that's going to make the knee twist inward, and so that's why people then have all these ACL injuries and the cartilage just wears away, because we take thousands of steps every day. With the walking and everything, we're supposed to take up to 10,000 steps a day, and so this equates to millions of steps by the time you're even in your 20s. So by 40 years of age, the average person has taken 50, 60 million steps. So then that's why, you reach that kind of golden age and all of a sudden your body starts falling apart. And you have hip pain, back pain, so.
Right. And a lot of people don't know this, but my specialty is podiatry. So, when it comes to fixing these things, we're talking about excessive surgery, fusing, cutting joints, and it's a heck of a, basically healing time. But you guys said there's a better treatment option, a newer, innovative treatment option, correct?
Exactly. And so, yeah, and again, I practice the old-fashioned way of cutting the bones and fusing them, and it's just a big, complicated surgery, lots of risks and complications. So it's like, look, what they do for the arteries when they close, they put a little stent into there, and that opens the artery, and the blood's flowing through again. And so why can't we put a little stent into that little sinus tarsi space so that we still allow all of the normal motion, but we kind of take away the excessive motion? And so this is where we have this revolutionary device called Hypercure. And with that, we're able to put this into patients' feet just through a small incision. And they're able to run and jump and play and do all of the things that they always wanted to do beforehand. So it's really amazing.
I'm just kind of curious, Dr. Ahn, you're practicing in Chicago, very popular procedure. How are the insurance companies in regards to covering this?
So that's kind of tricky because nowadays insurance plans, they have different reasons and excuses not to cover sometimes. And, we're having some issues, but I always like to emphasize about what is the best treatment solution for patient, not really if insurance covers this or not. So big part of my mission is to educate patients about the best treatment solution.
And you said there's really no complications or real major risk factors of this procedure.
Exactly. So this implant's been on the market for over 12 years. There's been tens of thousands of them put into both children and adults. And the worst thing that we've ever seen is just that some patients, because they've been walking a certain way and now they're realigned, that they have adjustment issues. And so we can take the stent out and no harm is done. So it's really a win-win situation. So
sounds great. And if folks want more information or if they want to find a specialist maybe in their area, is there a good website for folks to go to learn more?
Yeah, absolutely. It's atlasfai.com.
Sounds great. Doctors, thank you so much for joining us today. Great information and in a sense of getting people back on their feet.
Absolutely. Our pleasure.
To be here. Yep, thank you.